Okay, so I am in the blue box, which means I'm out of the patient's room, and a couple things could be happening. I could be reviewing my patient's chart. I could be looking at the MAR and the TAR, or I could be getting ready to do a med check, or I could be calling somebody, making a phone call. So all of those things are going to happen right here, all right? But right now we are going to talk about doing med checks and that kind of thing. So when we do our med checks, we do our first 2 med checks in the med room right here, all right? And our medications are typically in here, in this fancy Pyxis here, aka tackle box, right? So if we're gonna do a med check, we are going to remove our meds from this med box. Okay, and we are not going to remove the pills from the bags, okay, ever. We're just going to take it out and put it here, which means we have pulled our meds for our patient and they're on our cart. We are going to do our 2 med checks right here, and then we're going to take our cart. You can follow me with that. We are going to go like this to the patient's bedside, yep. And we are going to do our 3rd med check right here at the patient's bedside. And typically, the patients are always going to have their ID band right here on this side of the bed, because we want you to always stand over here to provide care and assess your patient on this side of the bed so that we can see what you're doing. And so you'll do your 3rd med check right here. You pretend that you gave this medication, gulp, all right? And then you're gonna take this medication and you're gonna take it and you're just gonna stick it right there in the white basket to know, so that I know that you were able to administer the med. And then that's it. And then you can go back to document at that point what you need to do. You can do that right here, or you can go back to the med room and document. Either way, you probably should document right away that you gave the med. And then you can move this wherever you need it to go.